Alex, it's good to meet you. I know you quite well because I know you're one of our people who come to Sheffield. But Alex, can you, just for the sake of people listening to this, just to introduce yourself, make yourself interesting? That's what I'm saying.
Yes. Okay. My name's Alex. I'm 36, 37 next month. I've been diagnosed with pulmonary hypertension for 10 years now. Live in Leicester. And yeah, I work part-time, fortunately for me, from home now. I've got a 15-year-old son that takes up a lot of time. And yeah, that's me.
God, I didn't realise your son was 15 now. Gosh.
He turned 15 last week, yeah, so time flies. Yeah, he was only 5 when I got diagnosed, well, approaching 5, so yeah.
Now, I know, Alex, you're quite involved with the PHA Facebook page and sort of seeing, you know, you've been seeing new people diagnosed with pulmonary hypertension over the recent past as well. And I think one of the real values of this conversation that we're going to have now is to let you just explain how you manage what some people are going to start to experience or are experiencing and things like that. But can you just tell us, just to give some context, what the path to your diagnosis was, how it was and how it happened, the good, the bad and the ugly?
Yeah, okay, so Finley was born in 2006, and at the start of 2007 was the first time really that I experienced my first blackout, and from then on it gradually got worse in terms of my breathing. I was struggling at the time. I lived in a 2 up, 2 down to get up the stairs, all while having a newborn. So I sort of put everything down to basically just being exhausted from that. I kept going to the doctors and trying to explain my symptoms, which were the main one, shortness of breath. You know, I couldn't keep my eyes open, basically. I was so tired all the time. I was starting to actually swell up as well. And at the time, the doctor had put it down to, well, my swelling was due to a medication that I was on. It was just like a contraceptive pill. And the fact that, you know, I was so tired and exhausted and struggling with my breathing was due to panic attacks and anxiety. Which
Alex,
at the time,
can I just ask, because you raised a really important point there, and I know a lot of people have been labelled with panic attacks and anxiety, particularly and unfortunately young females and young mums, etc. How did you handle that? What was it like being told that?
To be honest, at the time, so my partner back then, he had quite a bad accident, and that resulted in a broken back and various other injuries. So he was actually in hospital for 8 weeks, and by the time he came home and learned how to walk again, it actually made sense to me that maybe I was having panic attacks and anxiety, and I was exhausted because I had an 18-month-old by that point, and that was the situation that was going on. So to me, it made sense, and I thought to myself, yeah, of course I am, exactly. Who wouldn't be with sort of what I had on my plate back then? So yeah, I think I just accepted it, to be honest.
So what was the prompt to get you down to getting a diagnosis? What was the crucial sort of stage in all of this? Okay,
so all of my symptoms and me going back and forwards to the doctors continued then until 2011. And at that time, I was then with my now husband, Ben, and my whole body was swollen. I couldn't even walk. I couldn't get from one room to the other. It was so difficult. And my son was supposed to be going to a birthday party, and I was trying my hardest to get him ready and sort all that. And Ben just said to me, it's no good, because I couldn't do it. He said, we're going to the Leicester A&E. And we're not going to come home until you're sorted, basically. And off we went, and it went from there. I didn't come home then for 6 weeks.
Gosh. So Ben took you and said, sort this woman out.
Yeah.
Yes. It was a good thing. But it was a long build up, wasn't it, to that, really?
Very long. Yeah.
Just thinking, and we'll move on to some other things, but just thinking now, if you had that time again, Ali, would you have done anything sooner? Would you have would something else have prompted sooner, do you think?
Oh, yeah, definitely. Yeah, we look back now, and even, you know, all my family, everybody says, why did we think it was that's just Alex?
Yeah.
You know, it sounds awful to say, but I think everybody thought I was lazy, and I didn't want to do anything. And so now we all look back and think, why did nobody say, this is not right, Alex, get to the doctors? And I think because I am one of those people that just tries to get on with it no matter what. And like I said earlier, if the doctor told me it was anxiety and panic attacks, back then I just believed that that's what it was because of the situation that I was in. And definitely would have gone to the doctors sooner. Well, I did go to the doctors, but I would have maybe pushed for more tests or asked to be referred, because obviously what was going on at home was not normal. Every time I walked up the stairs, I passed out. I couldn't bend down to put stuff in the washing machine without thinking I was going to collapse. They actually, when I went into hospital, drained 12 litres of fluid off of me. So that's how swollen I was. It's ridiculous, really. Yeah.
So can you remember the time that you and Ben were told that somebody said this is pulmonary hypertension? Can you remember that time and what it was like? Was it, what was it like?
Yeah, vaguely. It's all a bit of a blur, to be honest. I think part of me was relieved that I knew what was finally wrong with me, and that there was a plan in place to hopefully, relieve my symptoms. But then obviously there's the other part of you that, I was petrified because Finley was just turning 5. And I thought, oh my gosh, like, what, you just don't know what, when you're having all that information given to you, it's sort of hard to absorb it all when all you're thinking about is, like my son and everything else.
Can you remember what the initial questions that you had in your head, whether you were asking them or not, that say you and Ben were asking, that you got this diagnosis of pulmonary hypertension? It's a very rare condition. Was it things like, well, what's the future? What sort of questions did you want to be answered fairly quickly?
Yeah, but basically my future, really. It was all I was bothered about at the time. Like I say, because Finley was so young, and I had, we had planned, we would have had a bigger family. That was then told to us that really isn't sort of the path that we can go down. So I knew then that I just wanted to know exactly how my future is going to be, for Finley's sake, really. Yeah.
And your conversations with Ben, were they helpful? Was that easy to do? Because obviously in a couple, whether it's married couple, whatever, there's a lot of support there. Not everybody gets that, but you had that. Was that really helpful? Was it? How did you approach those conversations together?
I think Ben's a very positive person anyway, and he'll always look for the positives in things. So, to be honest, our conversations were sort of quite. How can I say it? They were quite easy, because we knew that we were just going to get through it together. I knew he wasn't going anywhere, and that we were going to get through it. So, yeah.
What about the rest of the family? Like your parents and those who you don't expect your daughter or your sister or whatever it is to be unwell. Approaching conversations like that, because it really is quite challenging. Don't worry about the dog in the background. Don't worry about that.
So sorry. Yeah,
it's okay. That's fine.
Someone comes near the front door to put something through, and he goes mad.
That's fine. That's what dogs are paid for. That's the job. Yeah. Yeah. Sorry. So just going back to like the other members of the family, more grown-up members of the family, having conversations and telling them about them and about your diagnosis and prognosis.
Yeah, I mean, to be honest, because I'd been transferred from Glenfield to Sheffield, with us living in Leicester with my family, they did spend quite a lot of time coming backwards and forwards. So when we did have the big chat, they were all there. They all wanted to be there, for us anyway, and sort of find out exactly what was going on. So a lot of the information obviously came from Dr. It's Charlie. I forget
Charlie
his
Elliott, Dr. Elliott. Yeah.
I forget his surname. So he sort of explained it all to all of us.
Okay. And as time's gone on, Alex, what about the conversations with your son as well? About those sorts of things, because a lot of people sort of, either parents or grandparents, sort of struggle to know how to have these conversations with the sons and daughters, grandsons, etc. How have you approached that, and how do you continue to approach that?
To be honest, I haven't sat down and told Finley the full story, and sometimes I do think to myself, should I? But from his eyes, because he was so young when I got diagnosed and I was poorly, this is how I've always been to him anyway. Yeah. So he's never really known me sort of any different. He knows I'm not well, and he knows the situation. He knows, he knows about the disease. But in terms of sitting him down and giving him the full works, we haven't actually done that.
I mean, probably you don't need to. I think it's been quite open, hasn't it? Because he's lived within that. I think we're listening to people either through my day job as a nurse consultant or through the PHA. Some people at times find themselves tied up in knots, trying to, with the best intentions, trying to protect the sons, daughters, grandchildren about the pulmonary hypertension or that diagnosis, and everything's okay, there's nothing wrong. And fortunately, we live in the world of the internet and everything's at hand. So I've heard of a number of parents sort of say that at first they tried to protect the children against whether it's good news or bad news, but then the children just go on the internet and type in pulmonary hypertension and say, well, you said nothing was wrong, but look at this. And we've got to remember that gone are the days where if we wanted to, certainly when I was really young, you either had to go to the library or get your Encyclopedia Britannica out and things like that. The moment I can do it on my phone within two ticks, and younger people are much more adapted at doing that. So it's good. I think it just sounds encouraging that you've just been open and it's living with it, isn't it? It's about just getting on with it and it being part of your family life.
That's it. And we are very open. We are an open family, and he knows that he can talk to us about anything. So like I say, he's never known any different. This is just always how I've been. So he doesn't actually have that many questions anyway.
Yeah. Just looking at if you were to meet a newly diagnosed individual with pulmonary hypertension, and from your experiences, what are the nuggets that you would want to sort of share with them about how to get on with life?
First of all, I think the main thing is to just take as much time as you need to absorb everything that you've just been told. There's no rush to be able, to get your head around it. Mm-hmm. Everybody deals with things differently, and just take the time to absorb all that information. I think it's a good thing to, if you do have any questions, obviously I know you guys are on the end of the phone all the time, which is amazing, but also the Facebook group I think is really helpful. I think it's important to speak to patients, so you've got real life experiences, rather than, like you say, it's so easy to go to Google and it's so outdated. You could put anything into Google and it would tell you that, tell you the worst news, basically. So yeah, I think just always try and find, there's always a positive, I think, in any situation. And yeah, just go with how you're feeling, and there's no time span in order to be able to absorb how things are going to be.
I mean, I think you raised a really good point there. The ability for people like yourselves, it's the peer support, isn't it? Because I know from a clinical perspective, doctors, nurses, etc., we can sort of give advice, but we're not living with it. I mean, in essence, and this is not to patronise you, Alex, but you're the experts in this. You know what it's like. You've had 10 years of living 24/7 with it, and so that peer support shouldn't be underestimated at all. And as you say, things like the Facebook sort of places. I mean, there are good things and bad things about all social media, but there's a lot of good there. And using it as a place, and I suppose I don't use Facebook, but you can go and watch and read stuff. You don't have to take part in it and learn from those sorts of things, isn't it? And to be reassured about how to do things. I don't know, for example, having conversations with parents or children and things like that. What did you do? Or working, not working, and you've got the expertise in bucket loads there. So that's really encouraging. If you had, I'm almost saying, if you were right at the beginning again of the diagnosis, that in the first 2 years, what was it that you needed to know to get on with things? What was was it about diagnosis? Was it about treatments? Was it about being able to work, not work, etc.? Was it about having more family and things like that? What are the things that you wanted to ask the questions about most?
It sounds quite morbid, really, but it really was all to do with my future, and I just went into panic mode, really, of how long I thought I was going to be here, and I did want answers for that, and no one can tell you those answers because each and every person is different. I mean, to be honest, I just sort of, back then, I got the diagnosis. And within a couple of weeks, I went back to work. I think I was almost in denial. I think I just got told all of this information. I started my medication, which made me feel so much better, and almost felt a bit like back to my old self, that I thought, right, let's go. And went straight back to work. Finley started school, and I think I just threw myself into stuff. So yeah, like I said earlier, I think you do need to sort of take the time, because it's only now, 10 years on, that I do think to myself, why I'm a bit nuts, really, for being the way I was back then. I should have just slowed down myself.
I mean, I think you raised the point there about, it almost sounds a bit morbid, but I don't think it is morbid. It's a really important question, isn't it? You've got a life-threatening illness. There's no pulmonary hypertension remains that situation. Blah 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 blah. You've been really poorly. You're blacking out walking up the stairs. It's not being morbid. It's really important questions, and I think it's healthy questions to explore, because we can have those conversations. And as you said, there's often no exact answers to that, but you responded very quickly to treatment. That's really positive. How are you now overall? How do you think life is at the moment? If you how impactful is PH on you?
Not very. I feel I keep myself extremely busy. I like to, be active. I think from looking now where I am, I've learned over the years that actually I can just live a normal life. For me, this is my experience with PH. I knew back then it was never going to stop me. I had too much. Finley was my priority. Obviously, Ben's my priority. My family, my parents, my sisters. Nothing was going to sort of stop me. So.
Is it a case of working out how to do normal things just in a different way, and those sorts of things. Yeah. And it is, I think that's why the ability to think these things through, what is important, rather than just sometimes we can just try and muddle way through it and it'll all be okay, but you have to think about different things in a different way. Now, can I ask you a question? And if you don't want to answer this, you don't need to, honestly, but because you talked right at the beginning about, you know, things that you had plans for the future when you were diagnosed, about family, etc. How impactful was that for yourself and Ben? And as I say, if you don't want to answer that, then, you know.
Oh no, that's fine. No, to be honest, it was basically one of the second or third things that we got told after I got given my diagnosis. So to start off with, it was actually we sort of put that to the side because we thought, okay, we'll shelve that for a while. But then over time, because like you said, I did respond to my treatment very quickly and very well, it sort of then did come back to the point that, well, maybe we should, we should look into it. So it was one of those things at the beginning when you get told, it didn't seem as important as what it first seemed, because I now had my diagnosis and I thought, right, I've got to deal with this now. So like I say, we did shelve it. So it wasn't until we sort of then decided to revisit it, and we sort of got quite far along the path that it then came to the point that we knew it was not going to be for us. And it's a hard one, but Finley is not Ben's child. So I think consciously for me, I automatically thought to myself, well, we've got Finley, we're okay. But then obviously you sort of think, well, that puts Ben in the situation that he hasn't got any children. And it was tough, but we just made sure that we remained on the same page, and that like we did when we got diagnosed, we knew we were just going to, get through it together, really, and dealt with it.
I mean, it's encouraging to hear that as well, because in serious illnesses and diagnoses, couples can really struggle sometimes, and it's bound to be just the taken for grantedness of life changes. But I think one of the things that is really clear from what you're saying, Alex, is having open and often sometimes difficult conversations with, like in your case, Ben, etc. The thing is not to talk about it, even if it's hard, it's still to talk about it, isn't it? Otherwise, these things can be a complete wedge, can't they?
Oh, definitely. I think it's one of the most important things is to speak about it. You can make yourself ill having the thoughts in your head and the way that you're thinking, and until you sort of say it out loud, it is a relief. And like you say, some conversations can be extremely hard and upsetting and upsetting for days, but actually once you have spoke about it and everything's out in the open, you can then deal with it and carry on.
It's no longer, sometimes I hear people, and I've heard it for sort of 20 years, been working in pulmonary hypertension 25 years, sometimes these things can become little secrets that nobody talks about. And I heard one person quite powerfully tell me, it's almost like this very thing that you're talking about with family and things like that, it became she used the phrase dirty little secret. It was so difficult to talk about. We never talked about it. And it was continually a place of upset, as you said, but it is upsetting, but we can work things through with that. So now it's 10 years since your diagnosis. Happy anniversary. What are you going to do? Anything? It might seem a bit bizarre to celebrate the anniversary.
I really did plan to, and then with COVID and everything, sometimes even though I would be outside at this time of the year, it sort of swayed me off a bit. Do you know what I mean? So I haven't really done anything. I mean, with my family, we've had a like a little get together and a little toast and a cheers and whatever. But I was hoping to actually do a bit of a big thing with my friends and family here at home. But yeah, unfortunately, no,
COVID.
I've not.
Yeah, COVID's put a paid to all. So what's it been like as you sort of come to a close this one? What's COVID been like for you? You know, you've been you got pulmonary hypertension, that fits you into this shielding group. So you've had lots of other labels thrown at you. How's COVID been for you?
To be honest, in the beginning, I was absolutely petrified. I'm not going to lie, I was so scared. But yeah, over time, I'm only just now starting to go out to places, and I still don't feel comfortable. I think it has had a quite a big impact on me mentally, and sort of feeling anxious about going to places. Yeah, so unfortunately, yeah, it has had an impact on me. But as always, I know I'll get back to being my normal self. It's just going to take a little longer. So,
and I think that's really sound advice as well, because lots of people in very similar position as you, Alex, with or without, you know, diagnosis like pulmonary hypertension, of getting back to, you know, feeling really quite anxious about stuff and getting out and about. And again, I think the sort of wise words about taking your time, your time, and just thinking. We'll finish on this question. It's a big one. Thinking of the future. And I know, and this might seem about out of the blue here, your treatments that you're on oral medicines at the moment. Has transplant ever been raised with you? The possibility of transplant, and what are your thoughts on transplant? Whether you need a transplant or whatever. What are your thoughts when it was raised with you? Because some people find that really quite a shocking bit of news.
Yeah, so I've been to 2 appointments over the 10 years at the transplant clinic, and I've got another one coming up in December. Yeah, the first appointment I had was way back at the beginning, so that was extremely scary. I know it is a possibility in the future, but for me, I sort of take things day by day, and at the moment, with how I feel, which I feel great, to be honest. I tend to shelf a lot of stuff. I don't know if that's a good thing or a bad thing, but for me, to put it to one side and not think about it actually works better for me daily to live my life. And when and if that situation does come along, then yeah, I'm going to have to deal with it then. And like I say, I've got an appointment coming up in December for there. So yeah, we'll see. Hopefully I'm too well.
Yeah, I mean, and I think that's one of the points, because transplant is potentially always part of the PH pathway if your age is right, and all sorts of other things. But I think one of the things that transplant is a potential safety net for some people, rather than that's where I'm heading to. And again, I think just with 10 years experience from yourself, it will have been raised, how to deal with that. And I don't think what you're talking about here, you're not put it under the carpet, you just put it on a shelf, and it's there if I need to. And we'll have to pull that book out in December, and you'll go for a discussion and things like that, and hopefully things will continue that as they are, that you continue being as well as you are, like that. But the safety net is there, and the process is there at the moment. So exactly. It's good to hear that. Well, Alex, I just want to thank you for sharing this time with us. It'll be really good in the future. I'm not going to put pressure on you. It'd be really good to get you and Ben to have a conversation with me again because I think there's some real gems of what you're talking about. And you're relatively younger, not as young as me. I mean, I think you're 37 now. I'm 35 next week. But I think it'd be really good to have that conversation, because we can do all sorts of magical things in managing people with pulmonary hypertension, and clever treatments and things like that. But it doesn't make you get on with life. It just enables those things to happen. And you and one or two other interviews that we've had is just sort of demonstrating that. We're really keen to build up this library of interviews of positive, but also honesty in it. That it's not easy. It's not easy. It's not rose tinted spectacles all the time.
No, it's
Well,
not.
we'll
And
have the dog in. We'll have the dog in as well, because I've seen he's walks around once or twice. What's his name? Yeah, I've seen him.
You've seen, well, I've got two. One's, I'm surprised you can't hear him snoring, actually. One's right behind you on the floor, and the other one's behind me down here.
All right. Yeah, we'll have the dogs in. Yeah, we're very keen on the dogs and stuff like that. Okay, well, thanks, as I said, thanks again, Alex, and we'll speak to you again soon. Okay?
Yeah, that's brilliant. All right then.